open with that welcome statement, or have we already done that?
Yes, thank you so much. I'll
Thank
read
you.
the meeting slide here. Good morning, everyone, and welcome to this DUR meeting. If you're dialing in via telephone, Google Meet has muted you. If you need to speak to the group, please press *6 on your phone to unmute and mute. We kindly ask that only those who are speaking to the group unmute their devices via Google Meet. DUR board members reserve questions until the end of presentations or ask in the Google Meet chat. For those providing public comment, which we don't have any today, but if you would like to provide public comment, a conflict of interest form must be on file. Please send an email to medicatepharmacy@utah.gov. Attendees that are not members of the DUR board, please enter your contact information in the Google Meet chat or send an email to medicatepharmacy@utah.gov. Please use the chat on the right if needed. And also a note here, AI note takers are not allowed for use in this meeting. And please provide normative feedback after the meeting to help us improve our process moving forward. And thank you. And I'll turn the time over to Dr. Weinstein.
Thank you for that. Do we have any introductions today?
Not today.
I think so. Okay, thank you. Then first order of business is to review and approve the minutes of the April meeting. I hope everybody's had a chance to look at them. Do we have any edits, review, or comments? Dr. Siegfried?
Just under number 2, my name is misspelled. It's not a big deal, but should be Siegfried. Thank you.
Thank you. We'll attend to that. Any other edits to the April minutes? If not, I'll take a motion to approve as amended.
I move to approve.
Second.
Thank you. I have a second. All in favor, please say aye. Aye.
Aye.
Aye.
Thank you. April minutes are approved. I think next we'll be looking at any prior authorization updates. Luis, do we have an item there?
Yeah, so the prior authorization forms reviewed last month in April have all been posted on our website for Kinsula, Agamree, IBAT inhibitors, and iDose TR.
Thank you. That was a hefty agenda. Thanks. And I see we have no public comment today, so let's go right to our new prior authorization criteria. Looks like, are we deferring the Amavi to the next meeting?
That's correct.
Yes. Okay. Then we'll go to item B. Iris, do we have a review, please, for the pivmesolinum?
Yes. Okay. Is everyone able to see the screen?
Yes, I
Yes, thank you.
Could you zoom in a little bit, Iris?
Yes.
Perfect, thank you.
Perfect. Okay, so I have Pivya or pivmesolinum to present today. The first criteria is the patient female and 18 years of age or older? Does the patient have a diagnosis of uncomplicated urinary tract infection? Does the provider attest that the patient does not show any signs of complicated infections such as fever greater than 100.4 Fahrenheit, flank pain, or structural abnormalities of the urinary tract? Have the patient tried and failed adequate empiric course of at least 3 first-line antibiotics, including but not limited to nitrofurantoin, trimethoprim, methoxycyl, fosfomycin, beta-lactams, such as amoxicillin with clavulanic, cephalexin, or fluoroquinolones, examples ciprofloxacin, levofloxacin, or has culture and sensitivity testing indicating that the infection is resistant to all first-line treatments. And then we have a line for first-line treatment trial details, and then culture showing resistance to all of the above and lab results requirement. Number 5, were culture and sensitivity tests performed and do all the results confirm that the infection is caused by an isolate that is susceptible to PIVIA, such as E. coli, P. mirabilis, and S. saprophyticus. And then we asked that they provide the test results as well. Number 6, is the requested dosing consistent with the FDA-approved dosing of 1 tablet by mouth 3 times a day for 3 to 7 days. And then we only approve for the course duration.
Thank you. Any questions from the board or comments? Dr. Smith?
Yeah, I was wondering if it should have unless contraindicated under number 4 to the list of antibiotics.
That is a good idea. I'll put that in.
Right. I think that is our default for making sure. Some people do have allergies, particularly, right, to antibiotics. I just have a question out of curiosity. These are advancing generations of antibiotics and a lot related to antibiotic resistance. So do we have, is the authorization intended to help guide antibiotic selection for limiting development of resistance?
Yes.
This is a question, sort of expecting that's a yes.
Yeah. And that is also according to the PI that it should be like after the first line treatments have all been trialed.
Right. Yeah, I'm hoping that, over time, a lot of this has been addressed in clinical practice. I come from the age where there was not always a lot of oversight. Some places I worked a lot and some places not at all. And patient demand for, the latest and the greatest, right? Didn't help us in this regard. Okay, I'll and my editorials. Thank you. Thank you very much. A motion to approve the PA as amended.
I can make that motion.
Thank you. May I have a second?
Second.
Thank you. All in favor? The PA is amended.
Aye.
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 Thank you. Our next item is Zolgensma and Itrisma. Let's see. Thank you.
All right, good morning, everyone. I'll be presenting Zolgensma and Itrisma PA criteria. Okay, number 1, is the medication being prescribed by or in consultation with a provider specializing in the treatment of spinal muscular atrophy? Has the provider submitted baseline anti-AAV9 antibody titer result and a test to monitor the anti-AAV9 antibody level after the treatment? Does the provider attest that the patient does not have advanced SMA, for example, for complete paralysis of limbs, permanent ventilator dependence? Has the provider performed an assessment of motor function development milestones using age-appropriate screening tools? Number 5, does the provider attest that the following tasks will be performed at the baseline and monitored after treatment until results return to baseline or as clinically appropriate? And those are the liver function, For clinical exam, AST, ALT, total bilirubin, prothrombin time, and creatinine, complete blood count, and troponin 1. Overall baseline health status. For example, hydration and nutritional status, active or recent infections, respiratory status, etc. Up-to-date vaccination status. Number 6, does the provider attest that the patient will receive systemic corticosteroid before and after the treatment? Does the provider attest that the patient has not received Zolgensma or Evisma before? Does the provider attest that the patient will not receive routine concomitant SMA modifying therapy, for example, Spinraza, Evrysdi, following administration of Zolgensma or Evisma? The prior authorizations for SMA modifying therapy will be terminated upon confirmed administration of Zolgensma or Evisma. The future use of SMA modifying therapy will only be considered if a post-Zolgensma or Evisma administration clinical assessment documents a suboptimal therapeutic response or decline in motor function requires supplemental treatment. And here are the additional criteria for Zolgensma. Does the patient have a documented diagnosis of spinal muscular atrophy with biallelic mutations in the survival motor neuron 1 gene? If this is for premature neonate, will the patient reach full-term gestational age by the time of Zolgensma administration? Will the patient be under 2 years old or on the date of the treatment? Does the patient weigh less than 21 kilogram? And the provider can put the current weight here. And here are the additional criteria for Evisma. Does the patient have a documented diagnosis of spinal muscular atrophy with mutations in the survival motor neuron 1 gene? Will the patient be 2 years or older on the date of treatment? Will Evisma be administered intradically by healthcare professional experienced in performing lumbar punctures? The authorization is 1 dose per lifetime, and there's no reauthorization. And here are the black box warnings. Okay, any questions about the criteria?
Thank you for that review. It appears the board has no comments or questions at this time. And if that's the case, we'll take a motion to approve the PA as written.
So moved.
And do I have a second?
Second.
Thank you. All in favor, please say aye.
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 Thank you very much.
Thank you.
And unless we have any other items or the board has anything else to address, we'll note our next meeting is scheduled for June the 11th. And I appreciate everybody's participation today. I have a motion to adjourn
So move.
and a second.
I'll second.
Thank you all. You have a wonderful day. We'll see you back in June.
Thank you.
Thanks, everyone.
Thank you.